Hello and welcome back to my channel. Today we're going to discuss a very important topic, medications for hypertension. Hypertension or high blood pressure is a common condition that, if left untreated, can lead to serious health problems such as heart disease, stroke, and kidney failure. Managing hypertension often involves a combination of lifestyle changes and medications. In this video, we will focus on the various types of commonly recommended medications used to treat hypertension, how they work, and what you need to know about taking them. Hi, I'm Dr. Knapp, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Hypertension is defined as having consistently high blood pressure, typically measured as 130/80 or higher. Blood pressure is the force of blood pushing against the walls of your arteries. When this pressure is too high, it puts extra strain on your heart and blood vessels, increasing the risk of cardiovascular diseases. Many people with hypertension may not experience any symptoms, which is why it is often referred to as the silent killer. Regular monitoring and management are essential to prevent complications. The management of hypertension often includes medications that work in different ways to lower blood pressure. One of the first lines of treatment include diuretics. These medications, also known as water pills, help the kidneys remove excess sodium and water from the body, reducing the volume of blood that needs to be pumped through the arteries. Common diuretics include hydrochlorothiazide and chlorthalidone. By decreasing the fluid in your blood vessels, diuretics help lower blood pressure and reduce the strain on your heart. These diuretics are typically well tolerated, but can lead to low potassium, sodium, or magnesium and should not be used by those who are pregnant, have gout, or high calcium levels. Angiotensin-converting enzyme inhibitors, or ACE inhibitors, are another important class of medications for hypertension. They work by blocking the formation of a hormone called angiotensin II, which normally causes blood vessels to narrow. By preventing this narrowing, ACE inhibitors help blood vessels relax and widen, lowering blood pressure. Some common ACE inhibitors include lisinopril, enalapril, and ramipril. ACE inhibitors are particularly beneficial for patients with other conditions such as heart failure, diabetes, or chronic kidney disease, as they can provide additional protective effects for the heart and kidneys. However, some patients may develop a persistent dry cough while taking ACE inhibitors. If this occurs, your doctor may switch you to an angiotensin II receptor blocker, or ARB. ARBs work similarly to ACE inhibitors but block the action of angiotensin II directly at its receptor, rather than preventing its formation. This results in blood vessels relaxing and widening, helping to lower blood pressure. Common ARBs include losartan, valsartan, and candesartan. ARBs are often used as an alternative for patients who cannot tolerate ACE inhibitors due to side effects like cough. Both are generally well tolerated, but like all medications, can have side effects. These may include dizziness if your blood pressure goes too low, or elevated potassium levels. Regular monitoring of blood pressure and kidney function is essential when taking these medications. They should be avoided in pregnancy. Beta blockers are another important group of medications for hypertension. They work by blocking the effects of adrenaline on the heart, which slows the heart rate and reduces the force of heart contractions. This helps to lower the blood pressure and reduce the workload on the heart. Common beta blockers include metoprolol, atenolol, and carvedilol. Beta blockers are particularly useful for patients with hypertension who also have other conditions such as angina or chest pain, or have a history of heart attack or arrhythmia such as atrial fibrillation. These medications help protect the heart and improve symptoms. However, they may not be suitable for everyone, especially those with asthma or certain heart rhythm disorders. It's important to take beta blockers exactly as prescribed and not to stop them suddenly, as this can cause serious complications such as a fast heart rate. Beta blockers can cause a slow heart rate, which can make you feel tired if your heart rate goes too low. Calcium channel blockers are another class of medications commonly used to treat hypertension. They work by preventing calcium from entering the muscle cells of the heart and blood vessels, which helps the blood vessels relax and reduces blood pressure. Common calcium channel blockers include amlodipine, diltiazem, and verapamil. Calcium channel blockers are also useful for treating conditions like angina and certain heart rhythm disorders. Side effects can include swelling in the ankles, headaches, and dizziness. If you experience any of these symptoms, it's important to talk to your doctor, who may adjust your dosage or switch you to a different medication. There are several other types of medications that may be used to manage hypertension. These include alpha blockers, which reduce nerve signals that tighten blood vessels, central agonists, which decrease blood vessel constriction, and vasodilators, which directly relax blood vessels. Each of these medications has a specific role and may be used alone or in combination with other drugs to achieve the best blood pressure control. Alpha blockers such as doxazosin and prazosin work by relaxing certain muscles and helping small blood vessels remain open. Central agonists like clonidine and methyldopa work by preventing your brain from sending signals to your nervous system to speed up your heart rate and narrow your blood vessels. Vasodilators such as hydralazine and minoxidil act directly on the muscles in the walls of your arteries, preventing the muscles from tightening and your arteries from narrowing. I just want to take a moment to ask that you hit that like button if you find this information useful, subscribe to my channel for more health-related content, and leave a comment below if you have any topics you want covered in future videos. Anyway, taking medications for hypertension as prescribed is crucial for managing the condition effectively. Skipping doses or stopping medications without consulting your doctor can lead to dangerously high blood pressure and increase the risk of serious complications. Regular follow-up appointments with your doctor are essential to monitor your condition, adjust medications as needed, and manage any side effects. Keep a list of your medications and bring it to every appointment. It's also important to communicate any new or worsening symptoms, as well as any side effects you experience. This will help your doctor adjust your treatment plan if needed. In addition to medications, lifestyle modifications play a crucial role in managing hypertension. This includes following a healthy diet, staying physically active, maintaining a healthy weight, and avoiding alcohol and tobacco. A balanced diet such as the DASH diet, or dietary approaches to stop hypertension, which is rich in fruits, vegetables, whole grains, and low-fat dairy products, can help lower blood pressure. Regular physical activity, as recommended by your doctor, can improve your heart health and help control blood pressure. Managing stress, getting enough rest, and limiting alcohol intake are also important factors in maintaining healthy blood pressure. Thank you for watching. Managing hypertension involves a combination of medications and lifestyle changes. By working closely with your doctor and making the necessary adjustments to your lifestyle, you can effectively control your blood pressure and reduce the risk of complications. If you want information on ways to lower your blood pressure besides medications, see my video on natural blood pressure lowering. As always, take care of yourself and make the most of your day.